Hi, I'm Alan Yorty, past president of Peace Health and also current Visant board member.
Hi, and I'm Jim Jorgensen. I'm the Chief Executive Officer at Visant.
We used to say pharmacy is really buried in the basement because that's where it used to be in the early days of hospital, because that's where all your pharmacists were located. Today, however, pharmacy is a much more significant part of healthcare and is really part of the strategy of any hospital or health system. It's a big part of the budget. It's a significantly complex ancillary service that has a lot to do with diagnosis and treatment of patients. And so for any transformational work today, focusing on pharmacy is absolutely critical. The best pharmacy consulting services are those that are very deep in what they do. They focus on pharmacy and they focus very deeply on a variety of aspects of pharmacy. And that's part of what Visant does. Visant has many different experts to cover all aspects of pharmacy as part of a transformational effort for a hospital or health system.
You know, when you stop to think of it, I think Alan's right on point in terms of pharmacy really being a strategic asset. You know, when you think about the impact that pharmacy can have on a health system in terms of patient care and outcomes, over 85% of patients in any healthcare system, the primary treatment modality are drugs. And when you think about safe practices, the number one contributor to medical error in the United States, pharmaceuticals. And when you think of finances, drugs are the fastest growing expense line in US healthcare expenditures, and also probably one of the top 3 sources of revenue for any healthcare system. And then when you think of regulatory compliance, at last count, there's almost 60 different external bodies, regulatory agencies, accrediting agencies, licensing agencies, where medication management really features prominently. So you put that all together, and you can really see that pharmacy can be very, very impactful. But as Alan noted, you really have to have some deep level of expertise to understand how all of that fits together and how all of that can be optimized.
So when I was the chair of the Oregon Health Council, pharmacy was 3 to 5% of the expense. Within 5 years, it became almost 10 or 11% of the expense. The growth was exponential. And they would say the cause of this rapid increase is research and development. But in fact, I think what we're seeing today is that the pharmaceutical industry is really focusing on narrow orphan drug development. And it's for a narrow group of the population with very difficult disease. And that is going to continue on. And we're just at the front end of the genomic revolution. And that is also going to continue to drive the importance of pharmacy first. And secondly, the cost of pharmacy overall as part of the total healthcare budget.
Yeah, I think that's really an important point because I think we're on the cusp of really a transformative shift in how we actually practice medicine. So you look now, I've been doing this for over 30 years and I've never been more excited about the potential impact that pharmacy can have. When you think about the fact that we've completely mapped the patient's cytochrome P450 system, so we know how drugs are metabolized in individual patients. We can establish what an individual patient's circadian rhythm is, so we know when to dose a drug in an individual patient. And as Alan mentioned, now we can map the human genome. So we know if there's a genetic anomaly, we can match the exact drug or therapy to that anomaly. So we can create precision medicine tailored to individual patients. And I don't think anyone is better suited to support that initiative other than pharmacists as the country's medication therapy experts. And also the financial component of that is extremely important because some of the new genetic therapies, there are multiple millions of dollars. The most recent one that came out, $2.5 million for a single infusion. So making sure that we use those drugs judiciously but use them appropriately, I think is going to be critical for the future viability of our healthcare system.
You can tell he's the pharmacist. The one thing I would also add to Jim's comment is that as you think about leading systems and leading hospitals, the leaders of pharmacy are now being placed, if not close to, sometimes in the C-suite. And they sometimes have responsibility for a variety of ancillary services. But it connotes the growing importance of pharmacy in the spectrum of overall healthcare. And that will simply continue. And the sooner health systems adopt a strategic approach to pharmacy, the better.
Philosophically, whenever we get the chance to work with the C-suite, we always try to position pharmacy as an integrated service line and really try to get senior executives to think about their pharmacy organization as a business within the context of the larger business of the healthcare system.
It drives sometimes as much as 30% of the total bottom line of an organization, especially if you're involved in clinical research. The pharmacy program itself can be a very significant contributor to the overall financial health of the organization.
And positioning that strategically within the organization, I think, is critical for that ultimate success, because it can't be that ancillary service in the basement anymore. I think it's imperative that strategically pharmacy is positioned correctly in the organization so that it reports to the right individuals that really understand that business potential and can unlock the full opportunity resident in high-performance pharmacy. And at Visant, our vision is to positively transform healthcare through pharmacy. So we would love the opportunity to help you accelerate that vision and unlock that full potential.
Visant. Visit us online for more information.